Do you ever feel confused because you haven't started the usual teenage changes, like breast growth or the first period? You're not alone. Some people have a condition called Pure Gonadal Dysgenesis, also known as Swyer Syndrome. Imagine your body's instruction book, the chromosomes, telling the gonads to become ovaries, but the pages are missing or scrambled, so the gonads stay underdeveloped. This simple story helps us see why the body may look typical on the outside, but miss key internal signals. Why does this happen? In most cases, a tiny change in the genetic code, especially in the SRY gene on the Y chromosome, stops the signal that tells the gonads to turn into testes. Even though the person's chromosomes read XY, the missing signal leaves the gonads as streaked tissue that cannot make sex hormones. Think of it like a recipe that forgets to add the key spice. The dish the gonads never gets its flavor hormones. Rarely, deletions or mutations in other sex determining genes like SOX9 or D, a X1 can cause the same outcome. What might you notice? No breast development by age 14 to 15. Why isn't my body changing like my friends? No period. I expected my first period, but it never came. Tall stature with long limbs. The lack of estrogen means the growth plates stay open longer. Sometimes mild acne or body hair, because the adrenal glands still make small amounts of androgens. Internally, the gonads are just thin strands of tissue, so there's no chance of natural fertility. How do doctors find out? A simple blood test checks hormone levels. Low estrogen, high gonadotropins FSH and LH signal the body is yelling for hormones it isn't getting. A karyotype chromosome test shows the XY pattern. An ultrasound or MRI looks for the streaked gonads. Treatment is straightforward. Start hormone replacement therapy, estrogen tablets or patches to trigger puberty, develop secondary sexual characteristics, and protect bone health. Because the streaked gonads can sometimes turn cancerous, doctors often recommend removing them surgically after diagnosis. The treatment plan is like installing a missing thermostat. It tells the body when to warm up, develop at the right time. Unfortunately, because the cause is a hidden genetic change that occurs before birth, there is no way to stop it from happening. However, early awareness helps. If a parent notices a child's delayed puberty, a quick visit to a pediatric endocrinologist can catch the condition early, allowing timely hormone therapy and safe removal of the gonadal tissue before any problems arise. What's new in research? Scientists are exploring the use of gene editing tools like CRISPR to correct SRY-related mutations in laboratory models, a future possibility for fixing the instruction book. Another promising area is stem cell therapy, turning a person's own cells into functional ovarian tissue, which could one day offer fertility options. Meanwhile, better imaging helps surgeons locate and remove streaked gonads more safely. These advances are still early, but they show hope that someday we might not just manage the condition, but truly repair it.